Hello and welcome to this video, which is going to be a short one, which is about different aspects of pain management. Now, if you suffer from chronic pain, you will know all too well that medication is not a complete answer. It's not really even a partial answer. If you're taking strong medication, you will know that the side effects can mean that you need to take other medication, and it just becomes an ever-decreasing circle. Now, there is absolutely nothing wrong with taking medication. I'm a retired pharmacist and I know how helpful medication can be. And almost certainly for anyone with chronic pain, some medication is going to be necessary. But the key, I think, is finding the right combination of medication that means that you've got a reasonable effect without getting too many side effects. And I know that that can actually be horrendously difficult because apart from paracetamol, all the common medications have side effects. They can either a lot of them have an effect on your gut, either can damage the gut or can cause constipation. And stronger drugs like opioids can make you feel very sleepy, woozy, spaced out, because that's how they work. They get through into the brain and they block the pain receptors in the brain. And I think the answer to this problem, it's very much a personal one. First of all, I would say, do you need to reduce your pain to nothing? A lot of people find that they have a level of pain that is tolerable. Some of you will know that I've just recently been diagnosed with osteoarthritis of the hip, and trust me, that's causing me an awful lot of pain and discomfort. But I am, touch wood, finding lots of wood to touch. The pain is not so bad that I'm having to take really strong painkillers. I'm managing with paracetamol and topical ibuprofen. And they're the two things that have minimal but not no side effects. But they don't completely kill the pain. I don't like calling them painkillers because nothing can really kill chronic pain. But when I get pain, for me, that's a signal that I need to think about my posture, because I know in my case that a lot of my pain is coming because I've got used to standing in bad posture. It's improved a bit when I've been doing Qigong, but unfortunately, decades of standing in a bad posture, which I've probably had since I was a child, thinking back, I had posture problems, has damaged that joint. That and the fact that I carry a few too many pounds don't help. So for me, pain is a trigger that I need to think about my posture and maybe change it, maybe change my position, maybe change what I'm doing to rest the joint. And the concept that there is a tolerable level of pain is one which comes into play if you opt for hypnotherapy for pain relief, where what happens is you're put into a trance and then you're asked to visualize maybe something like a dial, and you set the dial at where your pain is now, and then you can move the dial down to a level that's comfortable for you. And a lot of people do not want to move the dial down to 0, which is quite strange because you would think they would, but I can actually understand why that is. So that's why these videos are about pain management, not talking about painkillers, because if you have chronic pain, all you can do is manage it so that it doesn't impinge too much on daily life, and so it's not causing you massive stress. And I can't emphasize enough that although conventional pain relieving drugs, analgesics, do have very marked effects, we also know that they have a profound placebo effect. And it's the fact that we can't conclusively prove for things like curcumin and CBD that the effect isn't placebo that actually stops those from becoming rather more widely available than they are, and certainly they're a long way from being prescribed on the NHS. So quite often the key to pain management is finding you causing the minimum pain, causing the minimum side effects, finding the placebo that works best for you, because there is nothing wrong with harnessing your placebo effect, whether you do that by taking paracetamol or rubbing a gel in or using aromatherapy oils or using anything else where the evidence, if you look in the medical journal, says, well, it could be useful, but there isn't enough of a conclusive effect for us to say, yes, we're going to prescribe this on the NHS. Acupuncture is a good one for that. So pain management is not something that should be passive for you. It shouldn't just be a case of you take the tablets that the doctor gives you or use the patches that the doctor gives you or whatever. You need to be actively involved, and you need to be actively deciding, well, okay, is there a level of pain that's tolerable for me, and how can I achieve that? Anyway, I'm going to do a few more of videos in this series. If you've got any questions, please ask away. If there's a particular technique you'd like me to discuss, please ask away, and I will be very, very happy to discuss it in a future video if I feel I'm qualified to do so. You know how to contact me if you want to talk to me about any of these issues, and I'll be doing another short video next week.